Rural imaging centers face a constant battle, providing advanced care with limited specialist resources. What if you could cut imaging costs by up to 70% by removing the need for a radiologist to be on site? This isn't just savings, it's a revenue accelerator, with some facilities reporting double-digit study growth. Imagine fewer cancellations, smoother workflows, and extended operating hours becoming your new standard. How is this possible, safe, and compliant? We'll now break down the regulations, technology, and real-world impact. The core problem has always been the radiologist shortage, a crisis felt most acutely in rural communities. But the landscape has changed. CMS has made virtual direct supervision for contrast studies permanent, starting in 2026. And this isn't just a government mandate. It is supported by the American College of Radiology. With the major regulatory hurdles cleared, what does this actually mean for the people in your community? It means patients no longer travel hours for a scan. Advanced diagnostics become a local service, improving outcomes. This is more than convenience, it is about health equity. Geography no longer dictates access to life-saving care. The most pressing question is patient safety. The data shows virtual protocols can actually improve safety standards. How is this possible? Because this is not a phone call. CMS mandates real-time two-way audio and video communication. This high-tech connection is fundamental, but it opens a vital question: who is physically with the patient? Virtual supervision requires a highly trained clinical professional, like a technologist or nurse, to be physically present. And their training is extensive. It covers patient screening, risk assessment, and administering emergency medication. This hub-and-spoke model is what makes the system so powerful. A single radiologist team can oversee numerous sites at once. One radiologist can cover clinics in 3 different counties in a single afternoon, without travel time. Your schedule has no more radiologist on-site bottlenecks, ending last-minute patient cancellations. For your radiologists, less travel, less burnout, and more time focused on clinical care, preventing coverage gaps. Modern platforms also solve a major administrative headache by automatically logging every detail for CMS audits. The case is compelling, but making it a reality requires careful planning. What are the pillars of a successful program? First, the on-site staff must be specifically trained and credentialed to assess patients and lead emergency interventions. Second, the technology cannot fail. This requires a durable and secure infrastructure on a HIPAA-compliant platform. Third, you must prepare for the worst with solid emergency protocols and regular mock drills, even for tech failures. Finally, while CMS has set the federal standard, you must also monitor evolving state-level policies to stay compliant. Success depends on trained people, reliable technology, and tested protocols within a compliant legal framework. So let's connect the dots. The new permanent CMS rule demands proof of compliance, making automated documentation platforms necessary. Those dramatic cost savings aren't just a line item. They fund a model that combats radiologist burnout and turnover. Ultimately, expanding patient access is only possible because reliable technology is paired with rigorous staff training. We've seen the finances, regulations, and protocols. What is the final takeaway for rural healthcare's future? Virtual contrast supervision is a practical, approved, and powerful solution available to imaging centers right now. It offers a proven way to improve operational efficiency and expand services while maintaining high patient safety standards. This is how we bridge the healthcare gap. This is how we make certain that quality care has no zip code. For administrators, the time to investigate is now. For technologists, this is a new frontier of skill and responsibility.